Important information for breastfeeding to be successful. You must know when breastfeeding children what is the contribution of breastfeeding to the health of the mother. Breastfeeding after childbirth helps the uterus contract and reduce bleeding. Breastfeeding strengthens the bond between the mother and the infant. From the mother's point of view, breastfeeding helps to make use of adipose tissue and thus return to your pre-pregnancy weight. Breastfeeding provides protection and reduces the risk of developing breast and ovarian cancer in the future. What is the contribution of breastfeeding to the health of the infant? Mother's milk is more than just food. It provides the infant with even protective immunity, as no other infant food can provide. Breastfeeding strengthens the bond between the infant and its mother, from the infant's point of view. Breastfeeding helps healthy growth. Breastfeeding strengthens the baby's immune system and helps protect against diseases such as ear infections, diarrhea, allergies, and more. Breastfeeding reduces the risk of sudden infant death syndrome. Breastfeeding reduces the risk of obesity in later life as well as obesity-related diseases such as diabetes and high blood pressure. How many times a day should a breastfed baby breastfeed? In the first days after birth and during the first weeks, the breastfed child often, about 8 to 12 times a day and for a continuous period. The number of breastfeeding times decreases as the baby grows. Create an agenda that makes it easier for the mother to act throughout the day. As the baby grows and begins to eat solids, at around the age of 6 months, there will be a gradual decrease in the frequency of breastfeeding. How do I know that the infant wants to breastfeed? The infant usually shows signs of searching, alert, moves his head from side to side, brings his hands to his mouth, and shows signs of sucking at the mouth. Crying is a late sign of hunger. So it is not preferable to wait until crying and to suggest breastfeeding before it appears. Does a breastfed baby have to suckle from both breasts at every meal? The correct way to breastfeed the infant is to suggest the first side to self-disengage the infant from the breast, allowing him to expel the air by raising the infant on the hands. And then suggesting the second side as well. Breastfeeding can be encouraged by putting on a nappy and moving the baby from one breast to the other, thus waking him up. When the baby is older, you can breastfeed at each feeding from one side, according to his desire. Are there any foods that a breastfeeding mother should avoid? No. There is no blanket recommendation to abstain from certain foods. A nursing mother can continue eating the food she is used to and loves. If, after the mother ate a certain food, she felt discomfort in the breastfed infant, it is preferable to avoid this food temporarily. Is there a need for food supplements, vitamins, and minerals to feed the mother during the breastfeeding period? No special nutritional supplements are needed. It is recommended that the nursing mother is keen on a variety of foods and on wise eating habits. There is a special need in the early days to drink a lot, up to 8 to 10 cups a day. In the first month after giving birth, the mother must continue to take iron tablets, to continue the pregnancy, carry out a blood test, and in case of anemia, she must receive treatment from the attending physician. It is important to stress, in general, every mother produces highly nutritious milk that is exactly suited to the needs of the infant. The importance of maintaining a reasonable nutritional menu lies in the preservation of the mother's database and her health. If a mother eats a diet that does not include a variety of foods or abstains from certain food groups, it is recommended to consult a nutritionist, doctor. Even if the mother's diet is deficient or poor, it is recommended to give breast milk to the nursing baby. Please subscribe to the channel and activate the alerts button, so that you receive notification of new videos. Listen to the information and be more positive by liking and sharing so that everyone can benefit from the information.